Nani, Andy Wheeler in the Zoom room. We got Jason Saws, Joseph, and myself, Victorious. Good morning.
Good morning, everybody. As we talked about yesterday with the superintendent of the Guam Department of Education, we got his reaction to the governor giving the green light officially in her executive order for the resumption of a face-to-face instruction in all institutions of learning. So today we're going to check in with the superintendent of Catholic schools, Dr. Juan Flores, and we've also got Bob Kelly from St. John's. We'll also be bringing into the Zoom room once we connect with him, Robert Crisostomo, the principal at St. Anthony's Catholic School. But we do have, as I mentioned, Dr. Flores and Bob in the Zoom room. So good morning, gentlemen.
Good morning. Good morning, Sabrina.
Good morning. So I guess we'll start with you, Bob. How prepared are you guys to resume classes, and when are you guys targeting to reopen?
So we had, in our schedule, we had January 11th as our time to restart. So the order does not allow it until January 18th. And so what we're going to do is we're going to have actually online classes for that 1 week, January 11th to the 15th. The 18th is, of course, a holiday. And so then on Tuesday, the 19th, we're going to bring the teachers back in so they can get comfortable with their classrooms. And then the kids will show up on the 20th. And, of course, the big caveat in the executive order was assuming all things remain the same and nothing changes. As far as what the preparations are going, we're still in pretty good shape from what we had before. We've made a few additional safety precautions. We have some plastic plexiglass shields for those in certain circumstances. And the air conditioner guy is working on the ultravioleting all the air conditionings this weekend, maybe even as we speak. Well, it might be a little early. So we're looking in pretty good shape as of right now.
Okay, Juan.
Good morning.
Good morning.
Yeah, so I met with all the Catholic school principals yesterday, and the different schools have different schedules. Some of them restarting online learning or continuing online learning as early as next week, and meetings for teachers as well to get prepared for the 19th, which is when most of the schools will come back to face-to-face instruction. One school is actually going to try to do it on the 18th to make up some time. And I think the schools are ready. As you know, the Catholic schools did have at least 1 week of online learning in August, and many of the protocols that were set up are the same protocols we're going to follow. There have been a lot of refinements, especially in terms of paying attention to contact tracing if necessary, and precautions in terms of isolation rooms, but for the most part, the schools have what it takes to get ready. We are still anticipating some services from that are being procured through the Department of Education from the based on CARES Act funding. Those include HEPA filters for all the classrooms, HEPA filters for the classrooms, the sneeze guards for student desks or for cafeterias for the high schools, and some webcam systems that are going to help the schools provide live streaming for those students whose families choose not to come to classes right as we start on the week of the 18th. But I think our schools are ready. I think the schools, a reporter asked me yesterday when schools have been thinking about online learning, face-to-face learning, and I told him I think it probably came after the first week of online learning.
Yes, that's giant. I definitely agree with that.
Both started to anticipate the idea of kids coming back to school, but no doubt the health and safety of the kids is foremost. There are parents who are apprehensive, but I think it's going to be our job to try to convince them to send the kids to school.
Mm-hmm. Good morning. We now have Robert Crisostomo. He is the principal over at St. Anthony's Catholic School. He's also a member-elect to the Guam Education Board. Good morning.
Morning, everybody. Sabrina.
I was
Nice to be here.
we're glad you're here too. And I was talking to Bob and Juan, just asking them just to start things off with preparations that are underway at for private schools, and in particular for St. Anthony's Catholic School. What are you guys doing to prepare, and when is the reopening?
All right, so the reopening for St. Anthony Catholic Schools begin remote learning. I have to support the superintendent's comments about our online learning, remote learning. We started in August, and we've been doing it for almost 7 hours a day. As you know, Sabrina, you're a parent over at St. Anthony. And we haven't stopped. We've been going pretty strong and picking up steam. We are going to have the teachers report back to school January 11 to conduct remote learning from the campus so that we can put a strain on our accessibility. And then January 19, we'll have full attendance for all our students on a face-to-face schedule. We do have some students and some parents who are apprehensive about coming back, so we offer both platforms, the remote learning and the face-to-face, and we're going to do it in a synchronized manner. We've upgraded our internet access with Docomo. The school has full high-speed internet right now, ready to go. Classrooms and offices will be outfitted with air purifiers, along with the HEPA purifiers that the superintendent was talking about. We have all our sanitization equipment, soaps, masks, and face shields. The superintendent talked about desk shields. We had a parent of students at St. Anthony who donated 3 classrooms worth of shielded desks and 3 air purifiers. And another parent followed suit and provided a full set of desks, shielded desks, and an air purifier for their child's classroom. So we have several of that going on. And finally, we are going to be implementing our e-library because of the remote. The pandemic caused disruption in the education system, but it also presented opportunities, and it forced us to explore remote learning. And I think we've got a great platform in place at St. Anthony that would be envious to a lot of schools, because we provide education not in the traditional manner, but remotely until the face-to-face learning can happen. And thank you to the governor for allowing the kids to come back to school on the 18th. We're going to start on the 19th for all students. And we have an accreditation visit, Sabrina, on March by Cognia. So we're looking, all this going on through the pandemic, we're still going through an accreditation visit. And finally, we're working with GHRA, Mary Rhodes, and DPHSS, along with the American Medical Center, on a rapid test initiative that they put in place. And it's entitled, Let's Heal Our Island. They have a Chamorro vernacular for it. I can't pronounce it, but it's Let's Heal Our Island. So St. Anthony is piloting it. I'm gonna get approval from our board. If they approve, I can test our staff at school immediately and get results within minutes, rather than waiting for public health and a couple of days later for the results. This way I can isolate a classroom, contain them, and dismiss, go back to remote learning for that class. But it gives us the flexibility of reacting to the virus if we suspect it's at the school. So that's what we're doing in a nutshell. I think we're ready. No, I don't think we are ready.
All right. So what will be the protocols, I guess, for everybody when the students, if you could just take us through when the students return on the 19th. Is going to be required that they wear masks, face shields, things like that, bring hand sanitizers. We'll start with you, Bob.
Sure. Okay. So masks, obviously, and the face shields are also something we're going to have the kids bring in. That's particularly important for lunch times. when they arrive on first of all, only students and faculty on campus, no parents, no visitors, nobody else. You just got to do that. When they arrive, they'll have temperatures taken. We have thermal scanners at a couple places, and then we have people with actual thermometers, the quick reads. We're elementary, middle, and high school on the same campus, and so we've staggered our arrival times by half an hour. Elementary comes at 8, middle at 8:30, high school at 9 o'clock. So we've staggered the arrival, we've also staggered the departures. Our desks, we've always been fortunate with our class size being relatively small anyway, so that there's no more than 15 students in a classroom, and we're able to spread the desks out to provide 6 feet distance between them. And there are a couple places where the plexiglass partitions will be needed as well, art class and things like that. Juan and I will be in a meeting with public health this afternoon, I think. I'm not sure if Robert's coming to that as well. And they'll go over the protocols that they've released that Juan and I have been reading for the past day and a half to finalize some of those final issues. But that's basically what you need to know. I'd also like to echo one of the things that Robert said about the online education being an opportunity. It's not the ideal, but there were some nice parts that we were able to take away. And I think we're going to try to incorporate those things to move the whole educational thing forward when we come back.
Mm-hmm. Juan, are you also still a principal at, is it Santa Barbara?
I have been overseeing operations at San Vicente.
Oh, San Vicente.
There will be a change starting next week. So I'll be back to having just one job, which would be a little bit of a reprieve. One thing about what Bob and Robert talked about, we know that even if we came back to school, that students having access to materials like books and magazines out of the library really is not practical for safety's sake. We are waiting for the procurement of online library resources for research and current age-appropriate news sources for kids that we're getting through EBSCO, one of the online reference companies in the country. And that would be the way for our students to be able to access information and use that information. I'm personally not a great fan of, edited textbooks. And I think having students have access to primary sources is probably going to help them to learn how to do some research and also to get information correctly. So we're hoping that will enhance what goes on in the classrooms. And one of the things that I mentioned to the teachers is, to the principals yesterday, is that we should continue to encourage our kids to use Google Classroom or other learning management systems for assignments and even for communication among their classmates when they're doing their work. So that is a change as far as most of our schools are concerned, and that will reduce the need for students to turn in papers and then have them corrected and handled by somebody else and then brought back to school. So there is a move to continue online efforts in the schools, even though the kids are coming to school face to face.
Robert, if you could kind of walk us through what students are going to expect on the first day, you said the 19th or 20th?
Yeah, so Sabrina, as you know, first day of school, this is practically the first day of school. We can't count August as the first. It's going to be chaotic. Any principal knows that, any teacher. So we changed our traffic flow at St. Anthony to make it more accessible. That's one of the things we did. We're going to have, like Bob said, we're going to have a temperature check. We're going to make sure that we ask the questions before they come into school and the campus. And Bob's right, the campus is strictly for teachers and students. No parents, no guests go beyond the designated area. The kids are escorted to class individually. There's a holding area for the kids who come early in the cafeteria. They're spaced out. They have breakfast, and then they go to the classrooms immediately as soon as the teachers arrive at 7:30. Lunch is in the classroom, so we are maintaining social bubbles at the school and their classroom size. As Bob said, we're not going to exceed 15, maybe 18 students in a classroom, depending on the size. So we're looking at all the protocols to be in place set by public health and CDC. But we also minimize the 6 feet to 4 feet for the schools because it's unrealistic for a school the size of St. Anthony, even it's a small school, but having students stand 6 feet apart at all times is almost impossible. It's really impossible. We are going to dust off our emergency operation plan to conduct fire drills and other drills necessary, so that all these things are happening, and our after school care and tutoring is going to be implemented on the first day back, so that parents can rest assured that students are still going to be cared for after they're released at 3 o'clock for the day. After school care will continue to 5 o'clock. So St. Anthony is ready. We're looking forward to an increase in enrollment. The superintendent has been pushing Catholic schools as a preferred educational system. I agree. I've been in the public school for 18 years as a principal, and now I'm a principal at a Catholic school, and I can tell you that it is a world of difference between the two, and the level of education that the Catholic school offers, and I'm sure the other private schools, Bob.
Yeah, I was about to talk about Episcopalian education.
So, you know, we're looking at increased enrollment. If any public school parents want to come over and maybe tour the school, any school in the private sector, I welcome them. It's a world of different. Mm-hmm. So that in a nutshell, Sabrina, is what St. Anthony's doing to prepare. My staff is ready. But I've got to tell you that 90% of my teachers and staff do not want to take the vaccine. And I'm going to be the first one in the school to take the vaccine. Superintendent mentioned that he'll be the first one in the Archdiocese to take the vaccine. So we're trying to build confidence in our stakeholders that taking the vaccine is a plus, and having a full staff and faculty vaccinated will give more confidence to the parents to send their kids back to school. 60% of my parents don't want to come back to school. They want to remain on remote learning for the rest of the year. But it is what it is.
Mm-hmm. Yeah.
For the record, though, I want to make it clear that I will get the vaccine if it could be put in apple pie rather than a needle. I would more readily accept it. That's my stand on the vaccine.
I support that one. I support that.
What about the Department of Education, they did a survey and registration, and only 30%, I think it's 30% of students will be returning to face-to-face instruction. And you said, Robert, only 40% will be returning back to campus?
Yes, at this time, I'm sure that as soon as day one comes, we're going to have an influx of, I want to attend school. Now, 80% of my stakeholders are in the private sector. The biggest sector that's received, that was devastated by this pandemic, was the private sector. Those parents want to get back to work, and the kids need to get back to school. Mm-hmm. And we're providing a safe environment for them to return to school.
Bob, what about over at St. John's?
We're about 75% want to return. I will say that kind of an interesting little statistical thing showed up. If you had one kid, the number was about 63% going to return. If you had two kids, it jumped to 80%. If you had 3 or 4 kids, it jumped to 100%. Get these kids out of here.
What about transportation? The Department of Education, they are working on, the working with the Department of Public Works. So what about with the private schools? What would
So-
be?
we
Go ahead, Bob.
we only have 3 or 4 kids who ever use the buses. We don't use our large number there. So for the most part, it's going to be the parents dropping the kids off and picking them up.
And with the Catholic schools, there are 7 schools who have provided data on students wanting to take advantage of public transportation. And I've been working with Vince Ariola at Department of Public Works to work out a schedule. They've given us the protocols for seating, the reduced seating in the buses. And we've provided them with the street addresses for the students who need transportation. There are some issues that we have to address, that they have to address, not the least of which is scheduling, but also what do we do in the transit system down at the Chamorro Village? Because that's where there are opportunities for students to congregate. So we want to make sure that when students go down there, they get off one bus and get right onto another bus rather than hanging out and socializing with students from different schools or even from the same school. But to follow the cohort model, especially for the elementary schools, to make sure those kids get on the buses. But partly because of the reduced number for the public schools and even the reduced number maybe for the Catholic schools, Vince Ariola has assured me that they're ready for bus transportation the week of the 18th or the week of the 19th when schools start.
And did Vince assure you that the buses will be sanitized in between that exchange?
Absolutely. And again, following the protocols, the alternate seating on the bus, kids required to have face masks, families being asked to make sure they check the kids before they get on the bus, because at the bus stop, the bus driver is not going to have the capacity to check kids' temperatures or to monitor to see if they have any symptoms. Otherwise, they'll be at the bus stop for an hour just checking other kids. So parents are going to be expected to watch their kids before they get on the bus.
Okay.
I had a question, gentlemen. Good morning, by the way. Obviously, during the pandemic, your school nurses are going to be pretty important. So have they received any additional training, or are you looking on to bring more staff, or how's that system working?
Some of
Our
the
nurse,
Catholic schools don't have nurses, but they have people on staff who are assigned. The Lieutenant Governor has asked me to work with Margaret Hattori Ochima from the University of Guam. She is helping us to provide maybe some professional development for teachers and maybe even some support, not teachers, but for those who are assigned to be health counselors at the school. So depending on the school, some of them have nurses, some of them have nursing assistants. One school has a retired doctor who's acting as the health counselor. But everybody in the school will be aware of what to do when students have symptoms, what to do when students need to be isolated, what to do when we deal with those with positive results from testing.
we have a school nurse, and she's been undergoing quite a bit of stuff. Actually, she beat everybody because as a nurse, she got her vaccine shot already. And so she's been undergoing a lot of stuff. I will say that there have been a number of conferences with DOE and public health teleconferences that have been going on. And so again, she's been able to take advantage of some of that element as well. So confident that she'll be able to help us, and she won't get sick.
There you go.
Yeah, St. Anthony has a school nurse. We're ready. She's been going through intense training. The school is applying for a CLIA certification to administer the rapid tests. So she's going through that training as well. She's gone through contact tracing training. And we have a very robust COVID mitigation manual on our website at sacsguam.org. Welcome anybody to go onto the website, St. Anthony, and has a lot of good information. Please look at it. If you're interested, come in.
You sell an advertisement on that site too, trying to drive traffic?
Bob,
Bob, opportunities, Bob.
Bob, is rapid testing something you guys are looking at implementing down the road?
Well, it's apparently I got to talk to Dr. Wen over at AMC for going around us here. As of this time, we don't have any plans on that. But after I talk to Dr. Wen, then maybe we'll.
He's on after
Hey,
you
Bob, I
guys.
have his number, Bob.
I do too.
Sabrina, there are some physicians who are working with the governor's office on a plan. They've gotten a grant for rapid testing as well in the schools and help with contact tracing. And I don't have all the details. All I told them this week was we're prepared to look into it and to pursue it. The plan that Robert talked about with the the Hotel Restaurant Association was presented to us, but the funding was not yet made available, and it wasn't clear that the governor's office was going to approve that funding for all the public and non-public schools. But there are other opportunities to do that. And again, we will continue to encourage people to take advantage of the testing that's available through public health,
Right.
if that's something they want.
Is it too early to talk about, because the GDOE, they did announce information about the resumption of interscholastic sports. Is that something that you guys are?
Oh, I had somebody want to talk to me about that yesterday, but he failed to follow through with a chat.
Okay.
Juan, do you know anything about that?
Yeah, so there are a lot of discussions with the IIAAG. There have not been clear indications of what is really going to be allowed, but the IIAAG has a set of protocols that I think are pretty stringent protocols that call for cohort practicing, and to ensure that students are interacting with members of their team in ways that do not encourage contact in case there is a chance of the transmission of the virus. So I think that the issue right now, and it's something on the minds of some of the principals who've talked to me individually, including the principal at a school in Upper Tumon. One of the issues is, especially with the elementary schools, we can adhere to all the cohort groupings in the schools, right? Keeping the kids in the same classrooms, assigning them desks so that if there's a need for contact tracing. But once we start talking about interscholastic sports, even practices, now we're talking about breaking those bubbles. Now we're talking about breaking the groups within the cohort. So we have to be really careful about that. There's no doubt that that the students want and their families want them to be more physically active. And so when parents ask me, I tell them to develop a regimen for their children, and some of the coaches have done that on their own. They've encouraged their athletes to set up regimens on their own or with their families, so they are physically active. There's no reason an organized operation has to take place. But IIAAG is working with the coaches to try to provide some kind of direction. Right now, most of that is working on the high schools, so that we can get to the point where we're going to be very comfortable with competition among the high schools.
Yeah, they're looking at starting up with the obvious outdoor easy ones. Cross country, beach volleyball, and tennis would be the ones that they're looking at starting up with the high school. And I know some of the schools are started practicing already. And so those are the first two, and that'll be interesting to watch how that rolls out. But yeah, as Juan pointed out, the bubble keeps getting larger and larger every time you add any new person in. And Dr. Cabrera I was at a presentation that he gave. He had this nice little graphic about if you have 5 people in your bubble, and then he started as those 5 people deal with other people, how those bubbles change and move. And it was a rather powerful presentation that he made that one time.
Anything, Robert, on sports?
Yeah, Sabrina, it was not even in the front burner on my plate. Interscholastic sports can wait till next year. I rather concentrate on the extracurricular activities and events like Academic Challenge Bowl, and other activities, chess club, robotics. Those are like gateway into the interscholastic activities. Right now, it's a bridge too far to even talk about interscholastics for St. Anthony. I put a dead stop, no, until we can get this under control, because as Bob and Superintendent said, those bubbles will be compromised as soon as we open it up to interscholastics. And you got to think, those kids who go and participate with other kids from other schools will come back to school the next day to face-to-face learning and possibly be infecting the rest of the class. So no, I don't want to take that chance. As a principal, I wouldn't even consider it. I've told my teachers, don't look forward to interscholastic sports until we can get a good sense of how it's going to be mitigated. Yeah.
Sorry, I did want to ask. I totally lost my train of thought. I am so sorry. So I'll just go to one of.
Happens to Juan and I all the time. Once you get to be a certain age, don't worry about it.
Yeah.
You're a little young for that, though.
No. I'm actually not.
Speak for yourself, Bob. You got other-
We have a couple of comments here on our Facebook. Elementary students will make sure that the bathrooms, water fountains, etc., get sanitized. What are the protocols? And what will you guys be doing?
Well, one of the things that has to happen is that we have to make sure there are good procedures for even how the students go to the bathroom now. We can't just let them out willy-nilly without some kind of order, because we want to make sure they do practice social distancing and that those facilities are sanitized as often as possible. Most of the Catholic schools actually went out and installed new hand washing sinks and sanitizing areas in the school where kids could get hand sanitizers. But you'll be having a lot of elementary students singing happy birthday twice as they wash their hands. Make sure they use the soap, make sure they have paper towels, and do it in an orderly fashion. Now, if we didn't have extra sinks, it could take days for them to wash their hands. I've watched kids wash their hands, and now I have children of my own, but they could spend days at the sinks. But that's being taken seriously. And so the key precautions we've been asked to follow: wearing masks, washing hands, checking for symptoms, social distancing. That's all a given. And I think that most of the Catholic schools, I'd say all the Catholic schools, followed that pretty well that first week. Maybe more so with the elementary kids, because they're used to a more disciplined way of being in school. But even lining up in the hallway, and keeping their distance is something that they have to get used to doing. I think the hardest thing for smaller kids is, they like to hug, they like to play with each other, they like to interact. And the Physicians Advisory Group, when we first put in our anticipated protocols, it called for no interaction, and they said you should have limited interaction, but you can't stop the kids from interacting in some way. We just don't want to make that the norm. But I think the parents that I've spoken to are really looking forward to their children interacting with other children. And when I've been on Zoom conferences for San Vicente and for other schools, when I've been on Zoom meetings or Zoom presentations or Zoom assemblies, it's amazing how the kids want to interact with each other, even on Zoom or on Google Meet, because I think they're ready to be part of a social group at school. And so that's something we could bring back to our schools. We can do it safely, and we can do it in a way that makes sure that the kids follow all the protocols that we set for them.
Bob, did you want to say something?
One of the things that we've done is actually we don't have any water fountains, the typical water fountains anymore. We've transitioned all of those to the top fill things, so the kids will be encouraged to bring their own bottles. and touchless type things. And yeah, I mean, and then all the other things that Juan said, we're going to have to control access to the lavatories. We're going to have to, yeah. So all of those type of protocol elements.
Yep. So
Robert?
Sabrina, at St. Anthony, like Bob said, we changed all our water fountains to the top-down dispensers. Kids can't stay there and drink from the fountain. So that's one. And as far as the bathrooms specifically, we have a monitor that controls the kids' movement into the restrooms, and they're there to sanitize the restrooms after each use. So every hour they're in there sanitizing as the kids use it, because it's going to be used frequently. So that's our protocol, and it's in our manual. I also want to put out that the smaller kids, the ones that need help going, there's an aide in the classroom that'll follow the students 2-3 at a time. And while they're waiting to go into the bathrooms, because you can't go in together, on the sidewalks, we put little stickers on the ground in the forms of shapes, so the students can be learning the shapes while they stand there waiting for their turn to go in the bathrooms. And we also have our school-wide learning expectations and prayers on those stickers, so as they're looking at it, they're actually learning while they're waiting to go into the restroom. So yeah, we put a lot of things in place at St. Anthony. I hope that translates when we take the ACT Aspire test. I don't know if will be given this year.
Well, you guys talked about the physicians advisory group. Robert, you talked about the rapid testing, and Bob, you said need to talk to AMC. Well, lo and behold, we do have from AMC, Dr. Ho Nguyen, and he's also the chairperson of the physicians advisory group. Good morning, Dr. Nguyen. Thank you so much for joining us. I don't know if you heard, but Mr. Chrysostoma was talking about how they're going to pilot the program that GHRA AMC have partnered on the rapid testing to help reopen Guam.
Yeah, good morning. Let me see. I think I'm on mute, but yeah, we I think through Mary Road, no, she kind of spearheaded this thing, and we just support her on this pilot program that we know. As you know, there's a lot of asymptomatic care out there, and we the program offers serial testing with the antigen test at the site, like at each school, each employer, each company. So it kind of try to catch any type, any employee or teacher or staff that have the virus but have minimal symptom. It's a very good program. It's nothing new. Mayo Clinic in the state are doing the same thing with Back to Work program. I know it's costly mostly because the material, the supply. So we really try to work with the governor and the public health to see if we can access the Binax antigen card, so that way we save the cost for the school and the company. That's something that even with the vaccine come on board, getting a vaccine doesn't mean that you stop testing. CDC and everyone really encourage that even with the vaccine, you continue to test, you continue to do the 3W to try to protect everyone around you. So it's an excellent program that we try to do, like I say, it's a pilot program to try to support the school and the company to go forward, so to minimize the risk of everyone, especially the students. So we're going to try. I know that we're going to try to work with St. Anthony first and see if they can keep their school open and minimize the risk on the student. As a parent, I want my kid to go back to school too, and I want them to go back to school in a safe place. And I know that all the private school, they did a beautiful job and take all the step to mitigate all the risks for the staff and the students. So I would like to say thank you for all the school to do that, and also for the public school too. I think the OE, they have a lot of work to do, but they did a lot of work already. So I think everyone looking forward to the kid to go back to school face to face. I know the parents are still concerned, but we have to kind of move forward with this this pandemic here.
Right. Well, gentlemen, except for you, Dr. Hoa, we're going to let you guys go. Was there any final comments you wanted to make about the return of face-to-face instruction?
We're looking forward to having the kids back. As Dr. Wen pointed out, virtually every parent and student is looking to get back the social elements to where the kids can interact in face-to-face manner. My son has a cadre of friends that they play various computer games religiously, and they crave that interaction as best they can. And I'll talk to Dr. Wen privately about choosing St. Anthony to pilot the program, but that'll be another conversation for another day. All right, and Dr. Wen, thank you for all that you're doing with the Physicians Advisory Group. Our numbers are. Dr. Cabrera made the point about Guam's numbers being low because the community's buying into the protocols, but we're buying into the protocols because the Physicians Advisory Group has been doing such a great job with their advice. So thank you very much, Dr. Wen. I appreciate it.
And I just want to encourage parents to make sure they communicate with their schools or pay attention to the information coming from the schools about what's going on. There are 13 Catholic schools. There are probably 13 ways these schools are easing into face-to-face instruction. So, and even though most of the schools are following certain protocols, they're following those protocols in different ways. Staggered entrances and exits, locations for parents to drop off kids, things like that. So they just need to make sure they communicate with their schools and heed the call from the schools to be very safe. And one thing that I know we've talked about before, if the schools are back in school, then families need to consider that they need to curtail some of their activities after school so that they don't continue to increase that bubble. So if that visit to the mall is really not necessary, hold off on going to the mall so that our kids will be safe until our community gets to a point where it's easy to move around as easily as possible.
And Mr. Crisostomo.
Yep, Sabrina, we're looking forward to seeing our kids come back. I just want to tell parents, St. Anthony, it's going to be chaotic in the morning. Please be patient. It's controlled chaos. I assure you, your kids will be safe at St. Anthony. I also want to throw in the fact that, as you mentioned earlier, I'm now a sitting elected board member in the Board of Education, and I'm self-appointing myself as the private school representative on the board because they never had one. And a lot of federal money flows into DOE, and I think private schools should get what they're entitled to. So I'm going to be the advocate for private schools and charter schools on the board. Fair warning to my fellow board members.
Hey, congratulations on that appointment. Congratulations on that appointment.
All right. Happy New Year, guys. Thank you so much for coming on.
Dr. Wynn, thank you for choosing St. Anthony, by the way.
Oh, you got to get that ticket. Happy New Year, everybody. Thanks
Happy
very
New
much.
Year.
Bye-bye now.
Thank you.
Ooh, you're in trouble, Dr. Hoa.